Today's webinar is entitled What Employers Need to Know About the COVID-19 Vaccine in the U.S., Risk Management and Legal Considerations, and is brought to you by the European American Chamber of Commerce, where Europeans and Americans connect to do business. My name is Samantha Spratt. I'm with the European American Chamber of Commerce Carolinas chapter, and I will be your host today. We have a very interesting and timely topic, so I'm sure this will be a vibrant discussion. Let me briefly introduce our panelists. We have Kenneth, Vice President, Employee Health and Benefits of Marsh and McLennan Agency, Janice Rosenthal, Registered Nurse, Healthcare and Clinical Consultant at Marsh and McLennan Agency Mid-Atlantic Region, and Penny Wofford, Shareholder, South Carolina Supreme Court Certified Specialist in Labor and Employment Law at Ogletree Deakins. We'll start with Ken, who will be our moderator today. Ken has more than 20 years of experience in technology and healthcare sales and consulting. He has spent almost the last decade helping employers manage costs, compliance, and technology in their employee health and benefit plans. Now, without further ado, Ken, please, the floor is yours.
Good morning, everybody, and thank you for joining us. It's a Friday morning. It's a beautiful day outside, and after a year, who would have thought we're 14 months into working remote from home? We're all zoomed out, so Friday morning talking about COVID vaccinations, maybe not the most exciting topic, so thank you for joining us, and we'll try to move quickly through some good information. We're not going to spend too much time talking about what's happened over the last year because we've all lived through this year of COVID, but as we all know, COVID has changed the world. It's brought out new technologies. We've dealt with cases and lockdowns and shortages in healthcare. We have seen new incremental deaths around the world that would not have occurred had COVID not happened. And it is interesting to see how that experience around the world is the same, so in population, the United States does kind of lead the number of cases, and but in general, our experiences are very similar. So when we talk to our Mercer colleagues in different countries, every country's got the same experience where you go to the grocery store and you can't buy a loaf of bread or a thing of toilet paper, or having lockdowns occur and the restaurants are not allowing. So there's a few buzzwords that have stood out, and one of them is we are truly in this together. So Janice will talk about this as we get into some of the clinical discussions, how 39% of citizens are expressing how they are experiencing more mental health issues, and mental health means more healthcare claims, more disability claims, and employers have to deal with that. What we want to look at for just a moment is almost half of all employees have skipped and prolonged or pushed off healthcare. And that's really important to know because as a healthcare claim gets pushed off, an employer is still going to see that claim when it does occur. So you'll see that between 1/3 and 1/2 of all employees have delayed getting a healthcare treatment last year, and this obviously spiked in the March to the summer time frame when the COVID lockdowns were most severe. People pushed off surgeries, dental offices were closed, we couldn't get in to see doctors, people started going to telemedicine, and it created what we call pent-up demand. So those claims are still going to occur, and the employer is still going to be paying for the healthcare cost. It's just been delayed. And then sometimes when the claim occurs, we are seeing that perhaps it's more costly because to treat a claim 6 or 12 months later, sometimes the employee's condition might be worse than if it was diagnosed and was treated much sooner had COVID not happened. So we pay close attention to this because from the employer side, when we are advising companies, they're typically on the hook for a healthcare cost, either on the preventative service or when a medical claim occurs and somebody's covered under the benefit plans, or in some cases in the United States, we see that get pushed off onto a workers' comp claim. So as we're talking about cost, in general with COVID vaccinations, there should not be a cost to the employee. And many citizens don't really realize this, that in the United States, the government is covering the cost the medications, and the vaccinations are fairly inexpensive. What's not shown really here is, the Moderna vaccination. There might be a small incremental cost for the delivery for the medical provider, but in general, no employee will pay for that. So there's really no cost. It is considered a preventative service. So, what's the take that employees have on vaccinations? Well, it's really interesting to see that 85% of people surveyed feel that the vaccine will be effective, yet only 69% of Americans say they're going to go get the vaccine. So why the discrepancy? And the number one reason is people talk about side effects. They don't want to deal with it. And the circles that I run in, family members, my wife who's getting her second shot today, many of them are pursuing the Pfizer vaccine because word of mouth is they hear that there's less side effects and less concerns. But what's also interesting is if you look at some of the other comments here, more testing is needed. The vaccine is riskier than just getting COVID. Or people don't trust the government, don't trust pharmaceutical companies, they don't believe in vaccinations. There's a lot of mistrust. And this might also just be tied to education, but this is really the bulk of the reasons why we don't have more people in our populations getting vaccinated. And that, sentiment is the same with our European colleagues. So when I talk to my Mercer folks in Europe, they hear a lot of the same voice from their employers there. There is a little bit more or less distrust in government because more people are believing in the vaccine, and I think more people in Europe are getting vaccinated. Maybe the United States of America, we have just a few more rebels in our country. But, what's the role of employers and where are employees getting information? So when you look here and see that 56% of our respondents are getting information from the news on COVID vaccination, you don't have to be a rocket scientist to know that that is really bad, especially in the United States. We have such a polarized media. It really doesn't matter if you're on a conservative or a liberal bent. If you watch the news, it's not really factual news. You're listening to opinions, and whichever media that you're looking at is going to be polarized on what kind of message is being communicated. And really, employees really want to receive better vaccine information and education from their healthcare providers and from their employers. Yet only 10% of employees are saying they're getting adequate information from their employer. So there's definitely a role that employers can play in helping educate employees, get information to them, and perhaps help facilitate and incentivize. And we will talk about that with Janice and Penny here in a second.
Okay, thank you, Ken.
I'm going to let Janice take some of the clinical aspect here, and just a quick introduction for Janice. Janice is a registered nurse. She works on our clinical and consulting team. Prior to joining Marsh McLennan agency, she worked at Bank of America, where she ran the data analytics and the wellness programming for all of Bank of America. So Janice, the Zoom is yours.
Thank you, Ken. I appreciate that. And thank you, everybody, for being here today. So I know, Ken, you had said earlier in your slides that it was approximately 36% of employees indicated that their stress levels were worse since the beginning of COVID. This is a more recent view. So this is actually as of early April. Almost 67% of employees indicate that their stress levels have increased since the beginning of COVID. And that has so much to do with just the isolation piece and the ongoing not knowing what's going to happen for kids and families and so forth. You can go to the next slide, please. So adults who reported stress and anxiety, again, in the United States, we're leading the pack with the identification of behavioral health issues. We're talking to all of our clients and all of our contacts about what can be done at the employer level to manage that stress and to try to mitigate some of those issues that we're seeing in the workplace, such as substance use, anxiety, depression, et cetera. UK is obviously right behind us, and right behind them is Canada. So This is a very, very much a worldwide issue, not just for the US. So let's go ahead and keep going, please, Ken. Thank you. I mentioned substance use. This is something that we're seeing in all of our data that we've really not seen to the level that we've seen it in our past data. And it all has to do with what are the COVID-related top diagnoses that are affecting all of our groups. Substance use in the age bins of 0 to 9, 10 to 19, and 19 to 26 are off the charts. Definitely opioid overdoses have increased tremendously. There was a CDC study that was just published in JAMA that looked at ER visits from 2018 through October 2020. And in the period of 2019 to 2020, opioid overdoses that hit ERs increased 46%. So very much an area of focus for all of us in terms of what we can do. And if we can go to the next slide, please. Thank you. Ken, you mentioned this. I'm finding the same thing. Employees want to hear from their employers what can be done to manage our behavioral health issues. More and more people are talking about their stress issues. The stigma of mental health is going away, and telemedicine, telehealth, behavioral health providers have just seen just a huge uptick in services that that parents need for their kids, that they need for themselves, who are homeschooling their children who are at home. So definitely something that employers are starting to really get focused on, and we're working with our groups on strategies to manage that. So go ahead, Ken, next one, please. So vaccine hesitancy, looking at CDC information, all of the vaccines that have been developed since the the early 20th century, measles, mumps, rubella, smallpox, the percentage of cure and eradication is almost at 100% across the board for everything. I mean, we still do see some cases of mumps and measles, pertussis in the school kids and so forth, but everything else has been eradicated and we just don't hear about it anymore. This is the reason why this vaccine is so important and that people need to get vaccinated. Let's keep going, please, Ken. So where are we now? I actually looked at this data as of today. As you know, the CDC has released guidance on mask wearing in the United States, that if you're outside, you don't need to wear a mask, but you still have to practice the common sense items like social distancing and washing your hands, and just making sure that you're with people that have also been vaccinated if you're not wearing a mask. But today, the total vaccinations that have been given, definitely it's daily. It's just a daily exponential increase. 237 million total doses have been given. Fully vaccinated in the United States is 29%, and that just tells us that people are taking this very seriously. We still need to keep pushing. The messaging still has to be out there. We have to be almost obnoxious about it with our employees, our friends, our families. Get vaccinated. There's absolutely no reason to put this off any further, because definitely COVID is much, much worse than the small side effects that you'll get from the vaccine. I myself experienced fatigue, so that was it. I know that others have said that they've had, arm pain, neck pain, nausea, chills, but not really anything other than what you might feel if you got a flu vaccine, frankly. So definitely something to bear in mind. Ken, we can go to the next slide, please. Okay, this just gives us another look at the uptake in terms of the vaccination rates and with the elderly, the pneumococcal vaccination rates, the flu vaccination rates have been good, not as flu, and interestingly enough, flu vaccinations haven't been as good in 2020 as they were in 2019, because I think people were trying to figure out, what do I do and where do I go, and do I get a flu vaccine? Definitely get a flu vaccine, no question. So it's definitely something that is extremely important for those at-risk groups, seniors, children over 16 can get their vaccinations as well. So all good things to be said about the COVID-19 vaccination. We can go to the next slide, please. So what you need to know, this is a slightly older slide in terms of, this was just before the vaccinations actually came out. So it was information that about the Pfizer and Moderna vaccines. Our chief medical officer participated in the clinical trial for Moderna. There were a lot of people that just gave up their time and made sure that they were on the front end of making sure that this vaccine was effective and could be given in a very fast time frame. The side effects, again, the injection site, so arm pain, headache, some chills. This is the worst, okay, that you could expect. And you can see that really fatigue was the biggest thing amongst all of the people that participated in the clinical trials. Fatigue was the most prevalent thing that people felt from the vaccine. So we can go ahead and move forward. And of course, Moderna and Pfizer vaccines are 2 shots. The J&J vaccine, Johnson & Johnson, is 1 shot. Should people be concerned about which vaccine to get? Get vaccinated. So Operation Warp Speed, this just gives you a sense for that vaccination hesitancy slide that Ken showed you a little bit ago, why people are concerned, what they're saying about the vaccine. Nothing was skipped in the course of developing this vaccine that would have otherwise been done in any other vaccination manufacturing process. What the manufacturers did was that they used platforms that had been developed for other vaccines that are very effective and very, very important. So the number of months that it took to complete this vaccination manufacturing process was 14 months compared to typically 73 months of manufacturing time frame, approval process, and go-to-market speed, plus the distribution process. So there was, I can see why somebody might say, well, gosh, 14 months, that's crazy. What happened? But nothing was skipped. And if you listen to Dr. Fauci, the CDC, everyone has put tremendous resources on this to be able to cut that time frame into a very short period of time. Let's go ahead and keep going if you wouldn't mind. So the vaccine distribution process, this is really for the Moderna and Pfizer vaccinations that, where they focused first to distribute the vaccine. So the frontline essential workers at a hospital, clinics, nursing facilities, doctors' offices, et cetera. The point was, get this out, get this into the hands of those people who are on the front lines dealing with death, dying, terrible conditions in the hospitals with overcrowding, just really stressful situations. And our healthcare workers and frontline essential workers really need to be congratulated for all of the work that they did. Tremendous work. Let's go ahead and keep going, please. So Marsh and McLennan Agency has a council called the Vendor Innovation Council, and our POTH team, Planning and Analytics for Total Health, which I sit on, I also sit on the Vendor Innovation Council, is comprised of several very high level people across the country, plus our people that are in front of our employer groups all of the time to look at vendors, because everybody's getting their door knocked on, right? To look at vendors, to be able to score them by best in class operations, licensing, outcomes, etc. And we look at vendors in all classes, but we did look at some vendors that were specific to COVID. So two of them were the call center support solution, and the second one was the on-site vaccination distribution piece. And we can handle your questions in just a moment, but this was really important because so many of our groups were saying we're inundated with calls from our employees, or our brokers were saying we're inundated with calls from our groups saying, what do we do and how do we do this? So let's go ahead, because I think we have a little bit of more information on the next slide. So we did an RFP, the Vendor Innovation Council did an RFP to 30 vendors, of which 2 vendors responded, plus another vendor that can do on-site employer vaccination clinics. But CVS Health and LabCorp responded in terms of what they had available to be able to manage any kinds of vaccination on-site clinics. And of course, we're reviewing more vendors as we go, especially as we're expecting that over some period of time in the very near future, the vaccinations will come out of emergency use authorization, meaning that employers will be able to purchase vaccines. Right now, the only people that can purchase the vaccines are Walgreens, CVS, those vendors that actually do on-site vaccination clinics. So an employer can't buy the vaccinations today from directly from a manufacturer because of the EAU situation. So keep going. Next slide. Thank you. Penny, I believe that this is where you may be picking up, and I'd like to turn the mic to you.
Thanks, Janice. So we're going to talk a little bit about the legal considerations now that Janice has updated you on the status of where we are with vaccination, in particular with employers. So let's talk about where we are with agency guidance for employers that surround vaccination. We have guidance from the EEOC that tells us that the COVID-19 is a direct threat. It's a direct threat to our employees, and the direct threat standard arises under the Americans with Disabilities Act. And under that act, we typically can't ask employees medical questions or require medical exams, except for when there's a direct threat in our workplace. So we know from the EEOC that COVID-19 is a direct threat. We can ask medical questions, and we can require medical screenings to a different degree than we're able to in normal times. We can ask employees if they've been vaccinated. The EEOC recently came out with guidance on that under the ADA. That is not considered a medical question. That's impermissible. However, we can't ask employees why they've chosen not to be vaccinated if they choose not to be vaccinated. So you want to make sure that you're asking the question, are you vaccinated? But you don't go the next step and ask why if someone's not vaccinated. You also can require proof of vaccination. So a good way to obtain proof is to get the CDC vaccination cards from employees so that you can fully understand their vaccination status. Have they received both doses of a 2-dose vaccination, and has 2 weeks elapsed since their last dose? That's the definition of being fully vaccinated. Now, in a moment, I'm going to tell you why it's important for you to consider tracking vaccination among your employees. There's several considerations we want to give for doing that. So put that question on hold, because I'll be sure to answer it. Next, we've received CDC and OSHA guidance for our workplaces. The CDC has vaccination guidance, particularly for the critical workforce. We'll go over that in just a bit as well. And OSHA is following the CDC guidance. Now, I do want to make one point clear to all of you. As employers, during COVID-19, we have looked to CDC and local public health authorities for guidance. The CDC guidance is just that. It's guidance, it's recommendations. They're not requirements. However, The CDC guidance is setting the standard for us, the standard of due care in our workplace. So I would follow, and we recommend at Ogletree that our clients follow the CDC guidance and treat it almost as a requirement. If you deviate from it at all, make sure you have a good reason for doing so. And then if your local public health guidance goes above and beyond what the CDC is recommending, then you must follow that guidance as well. A challenge for us all has been if we have multi-state operations here in the US, each state has its own local public health guidance, and there may be different requirements that we have to follow in the various states. It is important for us to look to state law and understand what we can do in any particular state jurisdiction. There are some states that have some proposed legislation to protect individuals who object to vaccination or other policy based on safety concerns. In South Carolina, we have a proposed bill. We don't know if it's going to get traction and passed or not. That would provide protection for an employee from adverse employment action if they choose not to be vaccinated. However, we also in South Carolina just received, just was signed into law last week, immunity legislation. That means employers are immune from any claims that employees or even customers or those that you do business with have contracted COVID-19. And that immunity legislation in South Carolina has gone farther than any immunity legislation passed in the US. It's a positive development for us who have operations in South Carolina. I will tell you that a condition to that immunity is that you will have immunity in your workplace if, and the law specifically says this, if you follow our national and our public local health guidance. So that almost necessarily makes the CDC guidance a requirement for you if you want to have immunity from COVID-related claims. So Ken, let's move on to talk about what we can do as employers with regard to mandatory vaccination and some considerations that you want to give. So can we have mandatory vaccination? This point is not crystal clear because there are various laws that intersect. The EEOC says we can have mandatory vaccination under the Americans with Disabilities Act as long as we show that direct threat standard. I'm going to talk a little bit more about that in a moment. OSHA just recently in the last 2 weeks has come out to say, hey, if you have mandatory vaccination and an employee experiences side effects as a result of the vaccination, that's recordable on your OSHA log. So those two agencies are implying that mandatory vaccination can exist and is okay. We have another law that hasn't been tested that's wholly outside of the employment realm, and it's under the Food and Drug Administration that says that there can't be forced vaccination when we have vaccinations that are in the current COVID vaccination status, which Janice referred to. It's in an EUA state, which means it's emergency use authorization only. It hasn't received full approval from the FDA. So we're unsure of how that law will be applied or what it means. Does it just mean that the government can't force vaccination, or does it mean that organizations or private entities couldn't also have mandatory vaccination? It's a little unclear. So where I'm heading with this is because of the lack of clarity, that almost all of the clients that we work with have not chosen to mandate vaccination. They've chosen to incentivize and encourage vaccination. And we'll talk about that in a moment. But let me just make a few points on mandatory vaccination in the event any of you are considering it. If you have mandatory vaccination, you still must offer accommodations to those who object to vaccination due to a disability or based on religious grounds. Title VII requires that we do that, as well as the Americans with Disabilities Act. So when we're looking at accommodations based on disability, it is in essence an employee who says it is not medically advisable for me to get vaccinated due to my medical condition. And there are some medical conditions in which the healthcare professionals are saying you should not be vaccinated if you have these conditions. And then for religious reasons, there's a very low threshold. You just have to have a sincerely religious held belief. And that would be enough for the employer to have an accommodation requirement. Our accommodation requirements mean we have to have conversations with the employee. We have to engage in an interactive process and determine alternatives. If we wanted to mandate vaccination, some alternatives could be additional safety measures that employee must follow. We next have to think through if we're going to require mandatory vaccination. Aside from the unclarity, the lack of clarity in the law about it, we have to think through what's truly going to be the consequences for noncompliance. If an employee doesn't get vaccinated, are you going to terminate their employment? Will they just be placed on a leave of absence until they're vaccinated, or until we have the direct threat standard alleviate, which means we have a reduction in COVID cases in the community, maybe in the whole US and maybe globally. We're not sure what the universe that we have to look at to determine whether the direct threat has abated. But you need to think through what would be the consequences if someone didn't get vaccinated. Keep in mind what I mentioned earlier about state law. There are some state laws that might prohibit you from terminating employment or taking adverse employment action if an employee objects to vaccination. Watch for those laws. Second, if you're going to mandate vaccination, it's going to be considered compensable time. So the time that it takes to get vaccinated will be at your expense. Any cost associated with vaccination will be at your expense. As Janice said, though, our government in the US is funding the vaccination costs. To the extent that there is a provider charge, that gets covered by your health plan. That's part of the COVID relief laws, that your plan has to pay for it. So there shouldn't be any cost for vaccination outside of your health plan or outside of what the government's paying for. But certainly the time that it takes to get vaccinated, and if the employee needs to be out of work due to any side effects, that's going to be considered compensable time because you required it or you mandated it as part of their job. Next, side effects. If someone has side effects, is that going to be covered by workers' compensation? And again, we're in novel territory now, but the answer is likely yes. If you mandated vaccination, that employee was vaccinated within the scope of their employment, and that would be compensable under our workers' comp law if they have side effects. The good news is, as Janice told you, majority of us are not having any severe side effects that would require any medical care. They're generally mild, and at most there might be a day or two off from work. But in more severe cases, that would be a compensable event. As I mentioned to you earlier, you would also, if an employee had side effects and you mandated vaccination, it would be a recordable event on your OSHA 300 log. You would have to record that. Finally, mandatory vaccination can't last forever. How long it lasts really depends on how long we have a direct threat. And it's unclear as to how we can look to see to what degree the direct threat abates. The considerations are what's our rate of community spread, and what percentage of your workforce have been fully vaccinated, because as your workforce becomes fully vaccinated, that alleviates some of the direct threat. So if you're considering mandatory vaccination, you need to take all of these things into account, and you need to watch for how long will mandatory vaccination be your policy. But Ken, let's move on to what most of our clients are doing. They're not looking at mandated vaccination. They're looking at incentives or encouraging vaccination. And we're in less difficult territory by encouraging and providing incentives. Certainly encouragement can just be messaging. And as Janice says so far, and Ken alluded to this as well too, the percentage of employer messaging hasn't been what employees would expect it to be. So just know that you can encourage vaccination. You can get information out to your employees on how to be vaccinated. You can provide avenues. And as more on-site vaccination becomes available, you might even want to make it convenient by having some on-site vaccination. With that said, if you want to do more and provide incentives, you certainly can. Those can be typically in the form of some type of monetary or benefit, an added benefit, to help push employees over the decision mark to get vaccinated. If you're offering incentives, there are things that you still have to consider from the legal perspective. And one is we still have to accommodate based on disability and religious beliefs. And that accommodation means that we have to provide an alternative incentive for some other activity that these individuals could participate in. So for example, if I'm an employee and I say, hey, I'm not able to get vaccinated because of a disability, a medical condition that makes it inadvisable for me to be vaccinated, but I still would like to have this extra vacation day, then you would simply say, okay, to qualify for that vacation day, here's something that you can do. And it just might be get a COVID test. or get a COVID test once a month for the next 3 months so that we can ensure you're not COVID positive in our workplace. That would be an accommodation. You would have to pay for that COVID test if that's your reasonable alternative standard, but that would be a form of accommodation that you would make. You also could just forgive the standard and give the incentive to those who are able to show that they're not able to be vaccinated due to disability or a religiously held belief. Second, depending on how you structure your incentives, they could be wellness programs. And if you have an incentive program that becomes a wellness program, there are other legal requirements that apply. Now, those legal requirements aren't onerous, but you do have to be mindful of them. So our wellness programs as employers are governed by HIPAA, the HIPAA non-discrimination rules, and we would just need to follow the parameters of those rules and how we structure that program. In general, if you're going to incentivize an employee to go to an outside, a third party to get vaccinated, a CVS, or even to a healthcare system, then that's not going to create a wellness program for you. If you have an on-site medical clinic and your on-site medical clinic will be providing vaccinations, then you'll need to look a little bit closer at whether you're creating a wellness program. Second, you need to look at the pay issues that are associated with your incentives. If you're providing additional dollars or benefits to employees, that's typically going to factor into hourly employees' regular rate for overtime purposes. So keep that in mind as well. Those are our considerations for incentives. Let's just end with where we are with our CDC guidance for those who are fully vaccinated. So Ken, if we go to the next slide, on this slide, I've outlined for you where we are with guidance for fully vaccinated. And this is where I circle back to what I originally mentioned that I would discuss, and that is, what are the advantages of tracking whether your employees are vaccinated or not? Well, there's a lot of advantages, and one of those advantages is that those who are fully vaccinated no longer have to quarantine if they have an exposure to a COVID positive individual. Now, we know that that's created a lot of workflow issues for us during the height of the pandemic when we have employees that report exposures. Either they've been exposed to a coworker who was COVID positive, or the more likelihood and what we experienced more so than anything was being exposed to a family member who was COVID positive. Then we know that we had to have that employee excluded from our workplace for at least 10 days. We got some guidance that reduced that down to 7 if they were tested and they tested negative no earlier than 5 days after the exposure. In the beginning of the pandemic, they had to quarantine for 14 days. So we've got some relief from the time, but if you have an employee that still has an exposure, then you're looking for a minimum amount of time of 7 days of them being out of work due to that exposure. Well, if your employee is fully vaccinated, they don't have to quarantine. They continue to report to work. You don't have any lost work time as a result of that. Second, when your employees travel, then they're not subject to quarantine or testing requirements. And the CDC just updated their guidance earlier this week to include international travel in that guidance as well. So whether you're traveling domestically or internationally, then you're not going to have to quarantine when you return from travel. Again, we avoid lost work time. A point that I do want to make crystal clear, though, is that the CDC still says for employers, you need to require masks for those who are fully vaccinated, and you need to still impose your social distancing policy as well as all your hygiene policies. Those continue even if you have those in your workforce that are fully vaccinated. And I can't stress this enough, because that CDC guidance and those recommendations create the standard of due care. OSHA is looking to the CDC guidance to see if you're fulfilling your duty to have a safe workplace. And some of the states, for example, South Carolina, is qualifying immunity from COVID claims only if you follow this guidance. So continue until we hear otherwise. Continue with your mask policies and continue with your social distancing policies and other CDC recommendations. So Ken, those are our legal considerations in a nutshell, and we have on the screen for you just some Ogletree COVID resources. We have some resources out of our international practice group as well. Although Janice, Ken, and I have primarily focused on your operations in the US, you can get some resources for your international operations as well. So Ken, I'm going to turn it back over to you to see if we have questions that Janice and I can address for the remainder of our time.
Sure. Thank you, Penny. That was very insightful. And we do have several questions that have been submitted and several of them in the queue here. One comment will be our contact information is here, so feel free to contact Penny, Janice, myself, or Samantha following this webinar with any questions. We have many visitors here from various states and actually international. So we can also connect you with local people in the local offices near you, if that would help. One question, let's talk practically about doing vaccinations on site. So I have one client that's a manufacturer here in the Southeast, and only one that is doing vaccines that are on site. They happen to have a close relationship with a local pharmacist, and that pharmacist is out of a community service offering local employers vaccine administration on site. And that's how they had accomplished it. But practically speaking, this is a question for both Penny and Janice. What are we seeing around the nation as far as how many employers are bringing vaccination delivery on site to their place of employment? Penny, if you could give some feedback, and then Janice, that would be great.
Well, Ken, we're just now seeing some on-site vaccination because it's just become available. So as the states have lifted and have fulfilled some of their obligation to vaccinate those most critical first and have opened up to any age, then we've seen that there are providers who are able to come on site, but it's been state specific. So for example, in Virginia, the Department of Health had a partnership from the beginning that there could be on-site vaccination. That was part of their plan in getting individuals vaccinated. But we've just now started to see, at least in our area, the ability for your on-site vendors, for those who've come to do on-site flu vaccinations, to have the ability to have enough vaccines to be able to come on site and vaccinate employees.
Okay. Janice?
Yes, so we also are just starting to see some of our groups, our largest groups actually, bring on-site vendors to their site for vaccinations. It's spotty. It can be very cost prohibitive if, for a small group. So at this point, it's a moving target every day. The cost to administer the shots is going to be changing over time. The CMS has said that they will approve a $40 admin fee. So I think that a lot of vendors are probably going to be changing their admin fees to accommodate that similar kind of admin fee structure. There is one large group that we've actually spoken to called Matrix Medical Network. It was part of Operation Warp Speed. They require a 3,000 employee life in a single location, so a big threshold of employees. They charge $20,000 a month as a retainer fee, plus the cost of the vaccine and any supplies. So it can be very cost prohibitive. And I think as we see the states, obviously they've opened up all of, as Penny said, all of the rules in terms of who can get a vaccine. We'll start seeing this shift to smaller employer groups, maybe not the lowest end of the market, but the smaller employer groups will become more affordable to have a CVS or a Walgreens come out. And I think Walgreens just removed their 500 life limit as a requirement for them to do on-site vaccines. So more to come.
Okay, thank you. So the on-site vaccinations are a challenge, and there's more to come. So here for the interim, Janice, a question for you. If an employer were to do just one or two things to help educate employees on obtaining a COVID vaccine, what should it be?
I think it should be, giving people the sense for some confidence that the vaccines are effective. Even getting maybe some of their employees to do success stories around their experience with the vaccine. Very important to sort of have that community messaging, not just from the employer, but from people that employees work with in their workplace. Very important. Again, stressing the social distancing, all of the hygiene requirements that are going to continue to be in place. I think those are the two things that employers could start with to get employees more comfortable and going out to get the vaccine.
And Penny, as employers encourage their employees to go get vaccination, you touched on this a little bit. Do employers have to pay for the time off to go get vaccinated? And then if an employee does go get vaccinated, should and can the employer ask or even ask when they are planning to go get vaccinated?
So the answer to that question is yes. We don't have to pay for the time that an employee takes to get vaccinated if we're only encouraging it and it's not mandatory. However, that has been probably the highest successful incentive that I've seen clients offer to date. Now, some of our clients are looking at how many, and of course, our clients are employers of various size in various industries, but employers are looking to see, okay, if we just offer to pay for your time to go get vaccinated, that removes a barrier or a challenge. For those of you who have been vaccinated, you call to make an appointment and you don't really get to say, no, I'm not available until Saturday at 2. There might be some more opportunities to that now that more and more have been vaccinated. But in these early days, you just took the appointment that was given to you, and that could be during your workday. So an incentive that employers have offered that's been successful is to say, we'll approve your time off to be vaccinated, and we'll pay you up to 2 hours of time to be vaccinated, so that you don't have any lost revenue or lost compensation. That's been an effective incentive, but you're not required to pay for that time if you're just encouraging it, Ken. Second, we can ask if you've been vaccinated. We just can't ask why. Okay, so we can ask, have you been vaccinated? And we can ask for proof of your vaccination. And one of the reasons why we can do that is because we have to determine what protocol we can put in place. If you're fully vaccinated, do we need to require you to quarantine following travel? If you're fully vaccinated, do we need to require you to quarantine following exposures? So it's necessary information for us to have. Now, I will go the next step in saying that once you know whether an employee has been vaccinated or not, that is confidential information under the Americans with Disabilities Act. So you can't publish it to the rest of your workforce. Only those with a need to know within your organization should have access to that information.
Yep. And I will add that for allowing employees time off, there is a tax credit that employers can obtain if you do allow employees time off to go get vaccinated.
There is. Ken, I'll add that is for employers with less than 500 employees. So it's the same tax credit, the payroll tax credit that was offered under the Family's First Coronavirus Relief Act, but that is available if you provide paid time off for vaccination and you have under 500 employees.
Yep. And there was a question related to this that comes into the chat that what are the risks to a company when they are told their employees must be vaccinated by a customer? If our employee will be sent to the customer site or are required to have in-person meetings there?
Ken, this has been a huge challenge for us. So that's where you're really looking at, can you mandate the vaccination or not? And having an open conversation with your customer, because it's really going to be their criteria that requires that mandatory vaccination. And depending on the relationship with that customer or vendor, whether they've now become a joint employer. So it's having an open and honest conversation. And then if you do want to mandate vaccination, just being clear with your customer that you do have to accommodate for disabilities and for religious beliefs. If an employee objects and the customer just won't bend on that requirement, if you can send them to another location, great. But sometimes that's not an option. And you're going to be left with whether to terminate that employee or put them on a furlough or reduce them. Hopefully a temporary layoff. It's a challenging situation that we don't know all of the answers to right now at this point. All of the risks that I talked about mandatory vaccination would apply in that scenario.
Yep. So right now we are seeing the #1 incentive for vaccination is receiving time off. And then behind that, we are seeing employers provide monetary incentives. Across the nation, this is a question, Janice, for you, and then also Penny. What are the most common incentive dollar amounts or other, probably the top 2 or 3 incentives that we are seeing across our client base in the U.S.?
So I'm afraid I'm going to have to punt this to Penny because I don't have that information at my fingertips. I think it's changing every day, and I need to consult with some other folks.
So yeah, Janice, I'll be happy to take this one and just let everyone know what I'm seeing with our clients. I mentioned earlier that the most popular has been paid time off. Some of our clients have gone through that and they go, we're about 40 or 50% of our employee population that's been vaccinated now, and they're looking to offer some additional incentives to try to bump up that percentage. So those additional incentives have come in the form of cash or gift cards. At the very beginning of the year, we had some guidance from the EEOC that's now been withdrawn. So you might have heard early on that we were going to be limited to de minimis amounts that we would be able to offer. And the example in the regulations were a water bottle. That's very de minimis to encourage someone to get vaccinated. That guidance has been lifted. So a good rule of thumb is to offer a cash incentive that's no greater than about 30% of what the cost of your health plan coverage would be. That's your employee contribution towards that health plan coverage. So we've seen a lot of employers offering $100 gift cards, $100 Amazon gift card, or $100 in cash. We've had some employers who have looked at having a drawing. If you're fully vaccinated, you'll be put in the hat for a drawing. We've had other clients who've just offered an additional vacation day or an additional paid time off day, not paying for the vaccination time in and of itself, but just giving you a free day to take off. Now, keep in mind, if you do those incentives, you still have to look for alternatives as accommodations for those who are disabled or those who have religious objections. But that's what I've seen so far, Ken.
Yep. I would say, and that's consistent with what we are seeing across MMA with most of our client base. And this is a question for both Janice and Penny. A little bit of a curveball question. You may not be expecting this one. Should we limit vaccine incentive programs to just 2021 or for future years as well? Think on the spot on this one real quickly.
Very good question.
Yeah, I'm very interested in Janice's view on this. From a legal perspective, I think we need to wait and see. We need to wait and see where we are, what guidance we have. The guidance is continually emerging. And Janice, you might be able to speak to this. We've heard that there may need to be boosters after 6 months.
Yes.
So
yes. Exactly, but we also feel that the boosters may go into a standardized vaccination kind of a program. So if you do a flu vaccine on site, that the boosters could be done on site, or that they're going to be preventive because they'll fall under the standard vaccinations that need to be done. And so more to come. Exactly, Penny. It's just we need to wait and see a little bit and wait for some of this guidance to mature.
I mean, guidance continues to evolve, and this is everything's a moving target over the last year and a half. I did want to come to a quick question here that Tad had asked: if a customer must they provide an accommodation as well if they require vaccinations?
So an accommodation has to be provided to your employees. The question is what your relationship with that customer is and what your employee is doing on site, and whether that makes your customer arguably a joint employer that would also have to allow that accommodation. So it's a much more complicated question, and probably we can answer outside of the context of the specific facts and circumstances, but you're very much wise to be attuned to the issue you. And if your customers are asking that employees you send to their site be employees that are fully vaccinated, there needs to be more discussion about it and more analysis on where the risk of liability lies with your employees who object to being vaccinated.
Yep. And there were questions about international travel and coming from Brazil, and I can quickly answer that. I mean, each country has got different designations, I believe, on travel risks. I know this personally because in 7 weeks from today, I go on vacation and I have to show a negative test to enter the country that I'm going. And then before I can board my return flight home, I have to take another test while on vacation. So regardless of what country you're traveling to and from, so this would include Brazil, if you show a negative test, which is required to board your flight back to the US, no, you wouldn't have to quarantine afterwards. And I believe that's pretty consistent with most countries. I do want to turn real quickly, Janice, we talked a little bit about the mental health concerns that employers are seeing. And there is more effort on trying to engage employees in a digital remote workforce, try to provide solutions that help with mental health concerns, depression, because those turn into healthcare claims. Can you give us a little bit more insight as to what kind of solutions that employers are turning to engage their employees and address that growing problem?
Yes, I can. Thank you. So definitely telemedicine for behavioral health has taken a tremendous spike. I see 3,000, 4,000, 5,000% uptick in utilization in just 2020 for behavioral health telemedicine visits. I believe that that is going to continue. And so employers that have been offering telemedicine visits are looking to enhance that benefit in many ways. Either it's dropping the copay or reducing the copay on those visits, enhancing their employee assistance programs, as well as providing training through mental health first aid at work for managers and leaders at companies to be able to recognize the workforce that is experiencing a hardship and be able to get them to the right resources and help them get help. When a parent has a child who is going through a mental health crisis, it's a horrible thing to have to go through that. If the child has to go into a rehab facility, a lot of those facilities out of network, it takes time to get them into those facilities and a lot of work by a lot of people, and it's extremely stressful. So employers are looking at ways that they can enhance those education pieces to help their employees know who to call, when to call, where to call, and educate their employees on almost a weekly basis. I mean, it's really become that critical.
And I'm personally seeing a few more clients expand their EAPs to more visits in person, and a couple clients expanding access to coaches and on-site health counselors as well. And some of that's being incorporated into wellness plans. So we're seeing that. Samantha, we are coming up on 1 hour, so I'm going to turn this back to you to close us out.
I actually had a quick question. We know many of our members are actually multinational companies. So do you have any additional comments on the import and export of vaccines?
Can you repeat that again?
Any additional comments on import and export of vaccines? As many of our members are actually multinational companies, you know, with locations in different countries.
Let me give a quick comment, and Penny, you might have insight into this as well. So what we are seeing is each country has different vaccines that are allowed. And so there are different laws, and just like we have state laws here in the US, there's not really an easy path to import vaccines from one country to another. And as I talk to my Mercer colleagues throughout Europe, in most places, my understanding is the vaccinations are still similar to the US, controlled and provided by the government. So it really reduces the ability for an employer to try to obtain vaccinations on their own and try to import it in for their employee use. Penny, do you have any other insight into that too?
So our only experience to date has been that it is very much government controlled, and even employers can't purchase their own vaccinations. We've had several clients that have on-site medical clinics, and they hire larger companies and they hire their own medical professionals. And their ability to vaccinate in their on-site medical clinics has only been in a partnership with the government. It's had to be either approved through a local health department with some authorization and training on distribution of the vaccinations at their workplace. So I would imagine that the same applies if you were a company here and you wanted to export some vaccinations, some vaccines. First of all, it's probably difficult for you to obtain them as a private entity, and then what the rules could be about sending them overseas. I can't say that I know specifically. I'm sure it's going to be highly restricted.
Thank you. Well, that was excellent. Thank you all. That concludes our today's webinar entitled What Employers Need to Know About the COVID-19 Vaccine in the US, Risk Management and Legal Considerations. Thanks to our great panelists, Kenneth Cole, Janice Rosenthal, and Penny Wolford for sharing their experience and insight. And thanks to all of you for joining today's discussion. Just as a reminder, our comments and opinions presented by our speakers today are their own and do not necessarily represent the views of the European American Chamber of Commerce or its members. Please stay in touch with your local chapter of the European American Chamber of Commerce for information on our upcoming webinars and events. And also be sure to look for a recording of this and other EACC webinars and events on our YouTube channel. Thanks once again, and farewell.
Thank you.
Thank you.